I'm a Russian facilitator of today's practice session with Mitio. Welcome. Can someone quickly give me a hand up if you can hear me properly, if the sound is okay? Okay, great. Perfect. I can see. Okay, thank you. Okay, as usual, before we begin, let me go over some reminders. I also put some, those announcements in the chat box for you if the link is required. So, everyone must arrive on time, stay the full hour, and participate in order to receive credit. Please put your name and your last name as they are spelled in your Kajabi account, if possible, if you figured out how to do it. If not, I will have to call you by the name you signed in, and then we'll figure out what your name and last name is. Also, if you can, please put your target language next to your name, and there is no need to enable your camera during the session. For new students or just for anyone who would like to observe, you can do so. And if you're going to be an observer, let me know by. Now, let's put those hands down. And next hand, I will ask for those who are going to be observers to put the hand up so I know who. Okay, perfect. So, like I said, those of you, especially the first-time students, you can observe just to know what to expect from the session. Any questions regarding the course, you can ask during Dr. Lee's Q&A sessions, which take place on Tuesdays, 6 p.m. Eastern Time, and Thursdays, 11 a.m. Eastern Time. The link is shared in the chat, and also you will notice that the last link that I shared in the chat is Dr. Lee's video, where she answers some frequently asked questions regarding Kajabi. And at the marker, at 4-minute marker, there is an answer to the question how to report your attendance. Okay. So look at if you still don't know how to do it, please have a look at that video. Dr. Lee explains it very, easily. Please have a dictionary with you. It can be paper, web-based, or application on the phone, whichever works best for you. Just make sure you actually use it, have it open, and look up any new terminology you do not know, even if it's not your turn to interpret, because chances are that term may appear in your dialogue. So we don't want you to, waste your time looking for the terminology when you could actually have done it before. Am I the only one who sees this video that popped up on the screen for whatever reason? I'm not sure why. Okay, got it. Okay, so also during this hour, just to take the advantage of this full time, you can practice note taking. Again, not only when it's just your time to interpret. And like I said, write down any new terminology. Practice by yourself daily. Don't just rely on these live sessions. We recommend WebMD and Medline Plus. We would also be happy to accept your recommendations on any practice resources you find helpful. Peer assessment is what we do in our chat box. Remember that you can always comment on your colleagues' performance if you speak each other's target language. You can help each other with terminology, and don't forget to encourage and compliment each other. Just reminding again that our participating students class capacity is 20. Well, we are under that, so that's great. In case we have full class and somebody arrives, later, and you're, over twice, if you're 21, 22, etc., you will just be observing, but you can still practice note taking, write down terminology, and while muted, you can still go ahead and practice your interpreting. Also reminding again about the option, especially for those of you who may be, who end up being observer way too often and see that you would like to finish the course faster. You can book a private 30-minute one-on-one live practice session, and that would cover one group practice session for you. I think that's about it. At the end, I will take some questions if we have any. And also, in case anyone would like to practice site translation, let me know when I call your name if you prefer to do site translation rather than scenario interpreting. Okay, now we are starting with our scenarios, and Evelyn will go first.
Hello.
Hello.
Hi.
Okay. So last time we haven't finished our kidney donor scenario, so this is where we will start today. Okay. So there was an aunt of a pediatric patient who's going to donate her kidney. So the doctor is talking to her. Did they explain to you how the nephrectomy will be performed?
¿Ya le explicaron cómo la nefrectomía será hecha?
A little bit.
Un poco, sí.
The way we do the surgery now is minimally invasive. It is a laparoscopic surgery.
La manera que hacemos la cirugía hoy en día es de mínima invasión con un laparoscopio.
Mhm. And what does that mean?
¿Y eso qué significa?
This means that in this procedure, they use a special camera called a laparoscope.
Eso significa que en este procedimiento se usa una cámara especial llamada laparoscopio.
That gives us an inside view of the abdominal cavity.
Eso nos da una vista de la parte de adentro de la cavidad estomacal.
We use the laparoscope to transmit a real-life picture of the internal organs.
Usamos esta cámara para transmitir fotos reales del momento. Interpreter needs repetition, please.
Yeah, it's real life picture of the internal organs. So I'm not sure if it would be photos.
Real.
It's basically like live video, as they go with the laparoscope internally.
Okay, so
or images, you can use the word images instead of picture.
Okay. So
it transmits a real life picture of the internal organs.
Okay, so transmite una imagen real de los órganos internos.
Mm-hmm. And you see it on a video monitor to guide us through the surgery.
Y podemos ver en el video para que nos guíe durante la cirugía.
Mm-hmm. Where are we? The laparoscope magnifies these images many times their actual size.
El laparoscopio magnifica estas imágenes varias veces.
Mm-hmm. Okay, very good. Thank you. Everett is next.
Hi, Tatiana, can you hear me?
Yes, I can hear perfectly. Mm-hmm.
Awesome.
Let's continue our kidney donor.
Sure.
Mm-hmm. So it provides us with a superior view of the abdomen.
Por lo que nos proporciona una vista superior del abdomen.
If you put a camera inside me, how big will the incision be?
Si usted coloca una cámara dentro de mí, ¿qué tan grande va a ser la incisión?
This kind of surgery will require 3 to 4 3-inch incisions.
Este tipo de procedimiento va a requerir incisiones que tendrán una longitud de 3 a 4 pulgadas.
In the belly, below the rib, on the midline to the side. You have to really imagine that or draw it.
This is your interpreter speaking. May I request a repetition, please?
Of course. Mm-hmm. In the belly, below the rib, on the midline to the side.
Serían en el estómago, luego por debajo de la costilla y en la línea de en medio por el costado.
Instead of a big incision on the lateral side of your abdomen.
Y esto sería en lugar de una incisión muy grande en el costado del abdomen.
During the procedure, carbon dioxide is passed through one of the incisions.
Durante el procedimiento, a través de una de las incisiones, se hace correr dióxido de carbono.
It's going into the abdominal cavity to lift the abdominal wall away from the organs below.
Y se coloca dentro de la cavidad abdominal para poder levantar el abdomen lejos de las paredes de los órganos.
Creating more operating space to perform the surgery.
Y esto nos proporciona un espacio que es más propenso a operación para poder proceder con la cirugía.
The pencil-thin laparoscope and surgical instruments are then inserted through the other incisions.
This is your interpreter speaking. May I request a repetition, please?
Of course. The pencil-thin laparoscope and surgical instruments are then inserted through the other incisions.
La parte delgada del laparoscopio y luego los instrumentos posteriormente se introducen a través de las incisiones.
Once the kidney is separated, the surgeon will remove it through a 7-centimeter non-muscle cutting incision in your bikini area.
Interpreter needs repetition, please.
Okay, let's see how somebody else interprets that. Your time is up. Let's see how others handle it. Let's see if they've been listening.
Understood, ma'am.
Okay, good job. Thank you. Very good
Thank you.
fluency.
Thank you.
Okay, next is Gustavo.
Hello, can you hear me?
Yes, I can hear perfectly. As you can see, Gustavo, you really have to kind of turn on your imagination. That will help you to interpret this sentence. Okay, so
Yes.
the surgeon will remove it through a 7-centimeter non-muscle cutting incision in your bikini area.
El cirujano lo removerá a través de una incisión de alrededor de 7 centímetros en su línea de bikini.
And I didn't ask any of you if anybody preferred to do side translation. No? I assume, let's agree, once I call your name, if you want to do side translation, tell me and we'll do it, okay? Okay, so who will take care of my kidney after it's removed?
¿Y quién va a dar cuidado de mi riñón después de que lo remueven?
Another surgical team will prepare the kidney for transplant into the recipient while we complete your procedure.
Otro equipo de cirujanos va a encargarse de llevar el riñón hacia o de insertar el riñón en el recipiente una vez que nosotros terminemos el procedimiento.
It all sounds quite complicated. What happens then?
Eso suena bastante complicado. ¿Y luego qué sucederá?
Now, once the procedure is finalized, we make sure there is no bleeding.
Una vez que se termina el procedimiento, nos vamos a asegurar de que no va a haber ningún sangramiento activo.
Then we empty the carbon dioxide from the abdominal cavity and close the small incisions.
Entonces, nosotros vamos a desocupar el dióxido de carbono de la cavidad abdominal y vamos a cerrar las incisiones pequeñas.
How long will I be in the hospital after the surgery?
¿Y cuánto tiempo voy a estar en el hospital después de la cirugía?
Not long. Most patients who undergo this procedure stay in the hospital no more than 2 days.
No mucho tiempo. La mayoría de pacientes se quedan en el hospital máximo 2 días después de la cirugía.
So with this procedure, I will not have any other risk but the unusual infection or bleeding, right?
So, con este procedimiento no tendré ninguna otra complicación más que lo inusual de tal vez una sangramiento o infección.
Generally, that is correct. Now, this is a serious decision that you must make by yourself.
Eso es lo que generalmente sucedería, pero esta es una decisión muy importante que usted debe tomar por sí mismo.
Okay, very good. Thank you.
May
Mhm.
I say something?
Sure.
Can I also do a little bit of text translation?
Let's see if we have time left because I allocated an
Sure.
equal amount of time for every student. If we have something in the end, just let me know and we can do it definitely. Mhm.
Thank you.
Okay, thank you. Thank you, Gustavo. Maria Alvarez?
Yes, hello.
Yes, hello. Switching to pediatric cardiology. Okay. Hi, my name is Susan. I'm the nurse practitioner and I will be working with Dr. Kim during this procedure.
Hola, mi nombre es Susan. Yo soy la enfermera de practicante que va a estar trabajando con el doctor
Dr. Kim. Dr. Kim.
con el doctor Kim.
Mhm. I have some questions about your child and will also go through his medical history.
Tengo unas preguntas sobre su hijo y también estaremos hablando sobre su historial médico.
Is he allergic to any kinds of medication?
¿Él es alérgico a algún medicamento?
Nothing that I know of.
No que yo sepa.
Any coughing, and if so, when did it start?
Él ha estado tosiendo y cuándo empezó.
Actually, yes, he does have coughing and it started 2 weeks ago.
Actualmente sí, ha estado tosiendo y comenzó hace 2 semanas.
How about now? Is he still coughing?
¿Y qué tal ahora? ¿Él sigue tosiendo?
He's getting better, but he still coughs sometimes.
Él está mejorando, pero continúa tosiendo de vez en cuando.
So is he taking any medication for his cough, and who gave him that medication?
Él está tomando algún medicamento para la tos y quién le recetó este medicamento.
No, he stopped taking it last week. We got it from his family doctor.
No, él dejó de tomarlo la semana pasada y lo obtuvimos de su doctor general.
We're going to evaluate his condition in order to determine whether or not he is well enough to have the procedure tomorrow.
Vamos a evaluar su condición y vamos a determinar si él podría tener el procedimiento mañana.
We don't want him coughing after the procedure, so once we're done talking, I will examine him.
No queremos que él esté con la tos durante este procedimiento, so cuando terminamos lo voy a examinar.
Is he going to be healthy after he's done with this procedure?
¿Él estaría bien después de que terminen con este procedimiento?
Yes, he will grow to adulthood and live a normal, active, and productive life.
Sí, él va a crecer, ser un adulto y va a tener una vida activa y productiva.
How long will this procedure take?
¿Cuánto tiempo este procedimiento se tomaría?
It takes from 4 to 6 hours. After that, he has to stay in the recovery room for an hour.
Se toma de 4 a 6 horas el procedimiento y después de eso se estaría en el cuarto de recuperamiento por 1 hora.
Okay, very good. Thank you, Maria.
Thank you.
Mariana is next.
Good evening, Tatiana.
Good evening. Let's continue. By the way, would you like to do side translation instead?
No, not today. I'm
Okay,
sorry.
no
Thank
problem.
you.
No, it's just asking because I
Mhm,
don't want you to lose that opportunity if that's what you prefer to do. Okay.
mhm.
So After the procedure, he can have family members visit him, but please limit the visits to 3 people at a time.
После процедуры ему можно, ему разрешают, чтобы члены семьи его посетили, но, пожалуйста, ограничите количество посетителей до 3 человек.
Мгм. Не могли бы вы рассказать нам обо всех рисках?
Would you mind telling us about all the risks, please?
There is a small chance of bleeding and infection, but we'll follow up on those.
Есть очень маленький шанс кровотечения и инфекции, но мы сделаем дополнительный визит с онкологией.
Oncology was not mentioned.
Oh,
We
I'm
will,
sorry.
we will follow up on those.
Oh, I'm sorry. I thought you said
Мгм.
oncology.
Мгм.
Okay. Ну, мы сделаем... Ну, мы
Basically,
узнаем...
they mean here that they're going to monitor it.
Okay, but we'll monitor it. Okay.
Yeah, but how do you say it in
Мы
Russian?
будем за этим наблюдать. I'm sorry. Мы будем за этим наблюдать.
Mhm. When he goes home today, don't let him eat or drink anything after midnight.
Когда он пойдет домой, когда он вернется домой, пожалуйста, не разрешайте ему кушать или пить, ничего не пить, не кушать после полуночи.
Мгм. Я уверена, что с ним все будет хорошо, потому что он любит спать.
I'm pretty sure everything's gonna be okay with him because he likes to sleep.
Он обычно идет спать около 9 вечера и спит до утра следующего дня. Он редко просыпается ночью.
He usually goes to sleep. Interpreting the repetition of time.
Около 9 вечера.
Oh, okay. He usually sleeps he usually goes to sleep around 9 o'clock and sleeps until the next morning without waking up.
Мгм. Но как насчет воды? Он может пить воду?
What about water? Is he allowed to drink water?
He can drink a little water, but not after 5 a.m. We'll schedule you to bring him here at 7 a.m. tomorrow morning.
Он может немножко пить воды, конечно, но не после 5 утра. И мы поставим вас в расписание сюда прийти к 7 часам утра.
Мгм. А как насчет его кашля?
What about his cough?
I'll examine him to see if he's okay for tomorrow's procedure, because we don't want him coughing.
Я его осмотрю и посмотрю, если он будет в порядке, чтобы пройти через процедуру завтра, потому что мы не хотим, чтобы он кашлял.
Okay, very good. Thank you,
Mhm.
Mariana.
Thank you.
Oksana.
Good evening.
Good evening. We'll continue here.
Okay.
If he's still coughing, we will wait until he's completely okay to have the procedure.
Если он все еще будет кашлять, мы должны дождаться, чтобы это прекратилось, для того, чтобы пройти через эту процедуру.
How long have you known about his heart problem?
Как давно вам известно о проблемах в его сердце?
С момента его рождения, со времени его рождения. На 6-й день врач сказал мне, что у него есть симптомы сердечного шума.
The doctor told me on the 6th, from the moment of his birth, on 6th day of his life, the doctor told me that he has a heart problem and he has шумы. I don't know how to. Let me look quickly.
Yeah, it's a certain heart condition. Starts with an M. Yeah. Murmur.
Murmur. That he has a murmur.
Он попросил меня, чтобы я принесла его в клинику через 5 месяцев для дальнейшего обследования.
He told me to bring the baby in 6 months for the further medical study,
Yeah, testing. Мгм.
testing.
Я принесла его, и доктор сказал подождать еще около года.
When I brought him, the doctor told me that I have to wait another year.
Он недавно видел его и подозревает нечто иное, чем просто невинный шум сердца.
He was обследовал. He was checking him recently, and he suspects that it's something more serious just than murmur.
Ага, невинный шум сердца.
That it's not just innocent
Мгм.
murmur in the heart,
Heart murmur.
heart
Мгм.
murmur.
Он уговорил нас обратиться к педиатрическому кардиологу немедленно.
He convinced us to go to the pediatric cardiologist immediately.
Мгм. Okay, I'd like to examine his growth and development to see if his weight and height are being met for his age.
Я бы хотел сейчас его обследовать и убедиться в том, что его вес и высота соответствуют его возрасту.
Мгм. Ну, рост rather than высота. Да?
Рост, да,
Мгм,
рост.
мгм.
Господи,
Okay, very
рост.
good. Thank you. Мгм.
Thank you, Татьяна.
Ага. Isaac is next.
Hi.
Yes, good evening. Let's continue. Mhm. So the doctor is asking, can he walk?
Él puede caminar.
He can walk, but very slowly, and he needs to hold on to the wall or something.
Él puede caminar, pero muy lento y tiene que agarrar algo como una pared.
Is he active and busy, or does he tire easily?
¿Él es activo y ocupado o se cansa rápido?
Do activities such as walking or playing cause shortness of breath or any blurriness in his lips?
Actividades como caminando, corriendo afectan su respiración o causan interpreter needs to look up a word.
Shortness of breath, or any blueness in his lips.
Interpreter needs repetition, please.
The full sentence? Okay.
The last few.
So do activities such as walking or playing cause shortness of breath or any blueness in his lips?
Actividades como caminando o jugando causan falta de respiración o sus labios azules.
He's doing okay, but there is one thing that I've noticed. He's not able to suck his bottle.
Él está bien, pero hay una cosa que he notado y es que no puede chupar su botella.
Every time we give him milk, we have to use a teaspoon to feed him.
Cada vez que le damos leche, hay que usar una cuchara para darle.
I see. Due to his coughing, I need to feel your child's chest as well as use a stethoscope to listen to his heart and lungs.
Debido a su tos, hay que chequear su interpreter needs repetition of the sentence, please.
Due to his coughing, I need to feel your child's chest as well as use a stethoscope to listen to the heart and lungs.
Debido a esa tos, hay que chequear su interpreter needs to look up a word.
Okay.
Su pecho y usar un telescopio para
Stethoscope. It's a
Yes,
stethoscope. It's something that doctors use to listen to the heart and the lungs.
estetoscopio
Mhm.
para chequear su interpreter needs repetition, please.
The heart and lungs.
Para chequear su.
Okay. Thank you, Isaac.
Thank you.
Thank you. Next is Jake?
Hello.
Yes, we are switching topics to ankyloglossia. To make things easier for you, in the brackets, I'm explaining what that is, but you can still check it in the dictionary. And we are starting with the doctor saying, "Hi, I'm Dr. Manner. How are you doing?"
Hola, soy el Dr. Manner. ¿Cómo está?
Let's see how Max is doing.
Vamos a ver cómo está Max.
I took him to his pediatric doctor because he's only gained a couple of pounds in the past 6 months.
Yo lo trae a su oficina del doctor porque solo ha ganado interpreting his repetition of the last part of the sentence.
A couple of pounds in the past 6 months.
Solo un pocas libras en las últimas meses.
I asked the pediatrician about that, and he said that it looks like his tongue is stuck to the bottom of his mouth.
Yo pregunté al pediátrico porque se parece que su lengua está atado al bajo de la boca.
Is he breastfeeding or bottle feeding?
¿Está usando la botella para comer o interpreting to look up a word? El pecho.
Breastfeeding, but he sucks very slowly.
Está comiendo por el pecho, pero está chupando muy lento.
Did Max pass his newborn hearing test?
¿Pasó la prueba de oír de infante?
Yes, he did.
Sí.
Did they say he had noisy breathing?
Dijeron que sus respiraciones son muy ruidosos.
No, not that I remember.
No, creo que no.
What did his primary pediatric doctor say?
¿Qué le dijo el doctor pediátrico? Sí, ¿qué le dijo a su pediátrico primaria?
Do you mean about the skin under his tongue?
¿Está hablando sobre la piel debajo de la lengua?
Yes. Did he find anything?
Sí, encontró algo.
He asked me to take Max to see an ENT specialist here at the hospital.
Me pidió para traerlo a un especialista para interpreter needs to look up.
Your colleagues are helping you in the chat.
Otorrinolaringólogo. Thank you.
Okay, thank you. Lam is next.
Hi.
Yes, good evening. Continuing. So your son has tongue tie, a condition where the tissue that attaches the tongue to the bottom of the mouth is abnormally short.
Interpreter need repetition for the second part. After the tissue.
Where the tissue that attaches the tongue to the bottom of the mouth is abnormally short.
Con bà là bị dính thắng lưỡi, tại vì đó chính là cái triệu chứng mà khi cái phần mô gắn liền lưỡi với lại là cái phần lưỡi với lại là phần miệng nó ngắn một cách bất thường.
That tissue is called frenulum. I put it in the chat for you.
Và cái phần mô đó được gọi là thắng lưỡi.
This may result in limited tongue movement.
Nó có thể làm giảm đi sự di chuyển linh động của lưỡi của con bà.
And in babies may lead to potential feeding problems.
Và đối với trẻ nhỏ thì nó có thể dẫn đến những cái vấn đề liên quan tới việc là bú sữa.
In most cases, the frenulum recedes on its own during the first year.
Trong một số trường hợp thì interpreter need repetition, please.
In most cases, the frenulum recedes on its own during the first year.
Trong một số hầu hết ở những cái trường hợp thì cái thắng lưỡi này nó sẽ biến mất sau khi cháu được sinh ra.
And it causes no problems with feeding or speech development.
Và nó sẽ không gây cản trở gì với việc mà cháu có thể bú hay là với cái khả năng nói của cháu, nó sẽ không ảnh hưởng gì nhiều.
But if it doesn't, there are several procedures we can do to fix it.
Nhưng mà nếu mà cái thắng lưỡi này nó vẫn còn ở đây thì có một số cái thủ thuật mà chúng ta có thể làm để chữa bệnh này cho cháu.
We really only recommend surgery if your child has significant breastfeeding, speech, or personal or social problems caused by the tongue restriction.
Chúng tôi chỉ thực sự khuyến khích phẫu thuật nếu như mà con bà thực sự có những cái vấn đề lớn liên quan tới việc là bú sữa này, những cái vấn đề về cá nhân, về xã hội hoặc là về khả năng nói của cháu. Lúc đó chúng ta mới cần làm phẫu thuật.
You may want to wait and see whether his frenulum stretches on its own.
Và chúng ta sẽ thêm thử là cái phần thắng lưỡi này của cháu nó có sẽ chúng ta có thể đợi và xem thử là phần thắng lưỡi này nó có giãn ra hay không.
If not, surgery may be needed to release the tongue.
Nếu không thì chúng ta cần phải làm phẫu thuật để có thể giải phóng cho lưỡi của cháu.
Okay, thank you.
Thank you.
Shumei is next.
Hi, good evening.
Yes, good evening. Continuing. Well, what kind of problems might we have with if we wait?
如果我们等的话，会发生什么样的问题呢？
A lot depends on the severity of the tongue tie.
那是完全取决于它那个多严重，这个舌头很紧的严重程度。
If the tongue is attached on the very tip of the tongue, and the
如果这个是在舌尖，然后呢attach 就是连到在牙龈上面。
feeding and speech are more likely to be affected.
喂奶跟讲话是最常常受到影响的。
It's not the case if the frenulum is attached further back.
如果是那个系带呢影响到比较后面的话，那就不会是这种状况。
Severe tongue tie can also cause problems with speech.
比较严重的舌根紧会影响到他的说话。
But what is more concerning to me is the fact that your baby hasn't been gaining enough weight over the past 6 months.
但是比较让我担心的是，他在过去的6个月里面都没有增加任何重量。
A baby's tongue plays an important role in breastfeeding.
Baby 的舌头呢，就是一个很重要的角色。当你在喂奶的时候。
If the baby's frenulum is too short, it can lead to a number of problems.
如果它的系带是太短的话呢，会引起蛮多问题的。
Such as low weight gain, as well as damaged nipples.
比如说是体重增加很少，还有呢毁坏了这个乳头。
Have you been experiencing a lot of pain during nursing?
你会有很多的疼痛，当你在喂它的时候吗？
My nipples were very sore in the beginning, but it's okay now.
乳头呢，刚开始非常的疼痛，现在好一点了。
Well, what we need to be careful of is that you don't develop plugged duct or mastitis.
I need to look up the word. Can you spell it for me?
Here. It's in the chat. Oh, and our time is up. You can look up the term. And we are switching to the next participant. Phoebe?
Hi.
Yes, good evening. We will
Good
continue.
evening. Okay.
So what we need to be careful of is that you don't develop plugged ducts or mastitis.
Interpreter needs to look up a word. Tenemos que tener cuidado para que usted no desarrolle ductos obstruidos ni mastitis.
Have you noticed your baby making a clicking sound while nursing?
¿Ha dado cuenta que su bebé hace un ruido como un clic cuando está mamando?
Yes, I have. It's been hard breastfeeding because it seems like he's constantly losing the nipple.
Sí, he notado, es difícil de dar mamá porque parece que él siempre está perdiendo la areola.
Well, it sounds like the tongue tie is causing breastfeeding difficulties, so I would suggest doing a frenectomy.
Parece que el anquiloglossia está causando problemas de comer, entonces le recomiendo una nefrectomía.
Not nephrectomy is
I'm sorry.
when we remove the kidney. You don't want to remove the kidney from the healthy child.
You know what? I thought that
Frenect-
sounded weird because we just went over that.
I know, yeah, and I know why you made exactly that mistake. But you see what I'm saying? How easy it is to say,
Yes.
yeah, we have to really be careful. Though I'm
Yes, of
sure we
course.
all will catch it right when we say it. Sometimes you would kind of replay it in slow motion and think, "Wow,
Yes.
did I really just say that?"
I did.
Yeah, but I understand why that particular mistake.
Okay.
Um,
Okay. Recomiendo que hacemos un frenectomía.
which is relatively painless procedure that we can do right here in the office.
¿Cuál es un procedimiento sin dolor que podemos hacer aquí en la oficina?
What we would do is simply clip the frenulum to loosen it.
Lo que vamos a hacer es simplemente cortamos el frenillo para soltarlo.
And it takes less than a second and there is almost no blood loss.
Toma menos de un segundo y no hay mucho pérdida de sangre.
It is similar to getting your ear pierced.
Es similar de, interpreter needs to look up a word. Es muy parecido cuando perforan las orejas.
Okay, thank you.
Thank you.
Okay, whoever signed in as Banny 7, Lara?
Yes, that's me.
So what is your actual name?
Norris Lara. I don't know how to change it, so that's why.
Norris, is first name Lara?
No, first name is Norris.
Norris, Noris?
Yes.
Okay, got it. Thank you. Okay, so we will change our topics to GI oncology. Let me see. Okay, here we go. Good morning. I'm Barbara, the nurse. I need to weigh you. Could you please stand on the scale?
Buenas. Interpreter needs repetition. Sorry.
Good morning. I'm Barbara, the nurse. I need to weigh you. Could you please stand on the scale?
Buenos días. Mi nombre es Barb y tengo que pesarlo primero. Por favor, póngase en la escala.
You probably need to remove your shoes since you have a pretty thick heel.
Probablemente se va a tener que quitar los zapatos ya que tiene un tacón bastante grueso.
Okay, 153 pounds. Let me measure you.
Oh, está bien. 153 libras, déjame medirlo.
Am I still 5'10"?
¿Todavía mido 5'10"?
Actually, you're 163 centimeters, much closer to 5'6".
En verdad es más cercano de 5'6", 163 centímetros.
Which is closer to 5'6".
¿Cuál es más cerca a 5, 6?
Oh, I guess I'm shrinking. I know that happens when you get older.
Oh, tal vez me estoy poniendo más pequeño, ya que yo sé que eso pasa cuando uno se pone más mayor. Encogiendo es el word.
Do you have your medical records with you and a list of medication you're on?
¿Usted tiene su historial médico con usted?
I'm going to sit here and sort through my documents.
Voy a sentarme aquí, voy a repasar o voy a buscar, a clasificar mis documentos.
Okay, but let me first measure your blood pressure. What is your birth date?
Primero, déjame tomar tu presión arterial. ¿Cuál es su fecha de nacimiento?
April 28, 1945.
Abril 28, 1945.
I think they wrote it wrong on the registration form. Can you please check?
Creo que lo escribieron mal en la registración. ¿Puedes investigar?
No, it's correct. And your blood pressure is 130/76, which is good.
Y sí, está correcto. Y su presión arterial está bien, está 130/76.
Well, it's the only good thing about me. Where's my folder? I need to find my medication list.
Bueno, eso es lo único bueno que tengo para mí. Tengo que buscar mis medicamentos. ¿Dónde está el folder?
Okay, very good. Thank you.
Thank you.
Geraldine?
Good evening,
Yes,
Tatiana.
good evening. Now let's continue. I also have my last lab report with me. Do you want to see it?
También tengo mi reporte de sangre conmigo. ¿Lo desea ver?
I also have a note from Dr. Siegel from my last visit to him. He's my primary care physician.
También tengo una nota del doctor Siegel de la última visita que tuve con él.
He's my primary care physician.
Él es mi doctor de cabecera.
And he recommended I get a consult. So I went online and found Dr. Amani, who seems to have the most experience in my kind of cancer.
Él me recomienda que tenga una consulta con el doctor Amani. Yo busqué en las redes sociales sobre la condición de mi cáncer.
This is the facilitator speaking. So the primary care physician did not recommend Dr. Amani. He just recommended consult, but the patient went online and found Dr. Amani, who seems to have the most expertise in my kind of cancer. Is that how you phrase it? I didn't think so.
Oh, I'm sorry. Can you repeat that again, please?
So my doctor recommended I get a consult. So I went online and found Dr. Amani, who seems to have the most experience in my kind of cancer.
Okay, mi doctor me recomienda que vea al doctor Amani.
No. The doctor just recommended to get a consultation. He did not recommend who to see. The patient says, so I went online and found Dr. Amani.
Okay.
You see what I mean?
Yes. Mi doctor recomienda que tenga una consulta. Yo me metí a las líneas sociales y busqué a un doctor que se llama Dr. Amani, que parece que tiene experiencia sobre el cáncer que tengo.
Exactly. Oh, here are my slides of my liver biopsy. I can find my medication list.
Tatiana, you say liver biopsy?
Yes, slides of my liver biopsy. I guess the images.
Sí, aquí tengo las imágenes de la biopsia de mi hígado.
I can't find my medication list.
No puedo encontrar la lista de mis medicamentos.
Okay, thank you. Satara?
Yes, good evening, Tatiana.
Yes, good evening.
Good evening.
Let's continue. I know I had it with me this morning. I have no idea where I put it.
The interpreter need repetition, the whole sentence, please.
Okay, so the patient can't find his medication list and he says, I know I had it with me this morning. I have no idea where I put it.
ខ្ញុំចាំថាខ្ញុំបានយកវាមកជាមួយពីព្រឹកមិញប៉ុន្តែខ្ញុំអត់បានដឹងថាវាទុកនៅកន្លែងណា
Okay, this is what I took during chemo, and here are sheets with the other medications.
The interpreter need slowly and repetition and slowly with a short sentence, please.
Okay. This is what I took during chemo.
នេះគឺជាអ្វីដែលខ្ញុំបានដាក់key mouse.
Do you know what that is?
Could I see the word?
It's chemotherapy. So in short,
chemotherapy. Yes, chemotherapy.
And here are sheets with the other medications.
នេះគឺជាกระดาษនៃតារាងថ្នាំខ្ញុំបានធ្វើ chemotherapy.
No, there was no chemotherapy in this segment.
Just
the other medications.
The previous segments about
but I thought you were done with the previous segment, no? Okay.
Yes.
So here we have pain pills, blood pressure medicine, and all my new medications.
នេះគឺជាថ្នាំបំបាត់ការឈឺចាប់ the first one is painkiller and the second one
blood pressure medicine and my new medications.
ហើយនឹងថ្នាំថ្មីរបស់ខ្ញុំ
I used to take supplements.
តើអ្នកធ្លាប់ប្រើថ្នាំ supplement នេះថ្នាំ បំប៉ន
I still take eye caps.
ខ្ញុំនៅបន្តនៅលេបថ្នាំ eye cap
because I have a history of macular degeneration.
ពីព្រោះខ្ញុំមានប្រវត្តិសាច់ដុំតូចស្វិតតូច degeneration, right?
Multivitamin with lutein.
វាជាប្រភេទវីតាមីនចម្រុះមានជាតិ lutein.
Okay, thank you.
Okay, thank you, Tatiana.
Sure. Albert?
Yes, dialogue, please.
Okay, thank you.
This is my maiden voyage.
Okay. So continuing, are these your pain medications?
¿Estos son sus analgésicos?
Yes, the other medicine wasn't effective anymore, so they want me to take this one.
Sí, la otra medicina no me hizo efecto, no me ayudó, y ahora quieren que tome otra medicina.
So you said these are your slides of the liver biopsy?
Entonces, usted dice que estas son las imágenes de su biopsia del hígado.
Yes, I also have CDs of that CAT scan that they did.
Sí, también interpreter needs just 1 second to look things up. CAT scan?
CAT scan.
Okay, can you repeat the sentence, please?
Sure. Yes, I also have CDs of the CAT scan they did.
Sí, también tengo una gamografía de los otros. También tengo gamografía.
What kind of tomography? Because again, there can be PET scan, there can be CT.
Come
This one is CAT scan. So CAT is computer or axial tomography. So what's the Spanish? Or do you say CAT in Spanish? CAT? Do you say
No,
CAT
I don't
scan?
think you'd say you wouldn't say cat. The
But
term
do
cat.
you in any way differentiate it from other types of scans? Well, write it down, look it up. We won't stop here, but
Okay.
because there are CAT scan, PET scan, CT, right?
Yeah, I think someone wrote it in somewhere. Tomografía axial computarizada.
Yeah, axial. Yeah.
Okay. Thank you.
And here are some papers with the type of chemotherapy I was on.
Y aquí hay unos papeles que indican el tipo de quimioterapia que tuve.
Do you have a note from your oncologist?
Interpreting is just 1 second. ¿No tiene una nota de su oncólogo?
I don't know. I was put on Xeloda, but it caused a bad rash. So, do you need my last lab report? I put the name of the medicine in the chat for you.
Oh, I didn't see that. Can you repeat? Interpreter needs
Yes.
repetition, please.
I don't know. I was put on Xeloda, but it caused a bad rash. Do you need my last lab report?
No sé, no estoy seguro, pero me dio mal reacción de urticaria y what was the last part of that sentence?
Do you need my last lab report?
Necesita los resultados de laboratorio más recientes.
Okay, thank you, Albert. Anya?
Hello?
Yes.
Can you hear me?
Yes, I can hear perfectly.
Okay.
We're doing Russian, right?
Yes.
Вам что-нибудь еще нужно? В конце моего последнего сеанса химии показатель крови у меня был только 300.
Do you need anything else? In my last chemotherapy, my blood work only shows 300.
Потом месяц спустя в июне он поднялся до 1650.
And in the last of June, it raised to 1650.
А теперь 3300, почти вдвое больше.
And now 330, and it's twice as much.
This is facilitator speaking. 3300 это сколько?
330, it's how much?
No, I'm asking you. Because you said 330. 300, that's 3,300.
Oh, 3,000, sorry.
Когда я проходил химиотерапию, моя иммунная система сдала. Не было аппетита, я не мог спать.
When I went through a chemotherapy, my immune system gave up and I was having difficulty, you said eating, right? Eating and sleep?
Не было аппетита, я не мог спать.
Oh, I didn't have appetite and sleep.
Поэтому сегодня я хочу узнать, какие у меня есть варианты, кроме операции.
And today I would like to know what other options I have besides chemotherapy.
Кроме операции.
Besides surgery.
Так как моя болезнь необратима, я хочу вести более качественный образ жизни.
It's because my disease is irreversible. I'd like to. Could you please repeat one more time?
Я хочу вести более качественный образ жизни.
I would like to have a better quality of life.
У меня проблемы со стулом, и это сопряжено с сильной болью.
I have an issue with
It's exactly the same in Russian.
Oh, with the stool? Could you please repeat one more time?
У меня проблемы со стулом, и это сопряжено с сильной болью.
Oh, I have an issue with a stool and it causes a lot of pain.
Я принимаю размягчители стула. Это вообще-то моя самая большая проблема.
And I take a medication for it. Could you please repeat one more time?
Я принимаю размягчители стула. Это вообще-то моя самая большая проблема.
Oh, I take a stool release medication, and it's my biggest problem.
Размягчители. It's very easy word in English. That's because the releasers are not размягчители. So you think of мягкий and then you add tweak it to make it. Yeah, Oksana is in the chat. Softener.
Oh, softener. Okay.
Okay. Otherwise, very good. Thank you.
Thank you.
I sense I missed someone. Did I? Because I think someone joined when we already started and I didn't see the name. Did I miss anyone? No? Well, unfortunately, the hour is up, so we do not have time for somebody wanting to do side translation. Next time, just let me know in advance that you would like to do that, and we'd do it. Or before starting, if you want, just do like half of your time or dialogue and write. That's a good question. Let's do cardiology. We started with cardiology. No, we started with nephrectomy, but cardiology is going to be our password. And like I said, if you look at the chat, there is, yeah, I'm going to post the links, but Dr. Lee explains in that video, and let me post it together with the links, where you can go to report your attendance, and that way you don't need to know the links or anything like that. She shows you where on Kajabi you can find where to report attendance. Okay. Any questions?
A question, please. If I got if I feel the 24 attendance already and I can practice more, will it be possible?
I'm not sure what the rules are right now. Double check. Theoretically, it is, but I'm not sure if there are any limitations on how many practice sessions you can have.
And another question regarding this. If the attendance of this time can be submitted to the next unit or next term?
Yes, because if you are doing, yeah, you can.
Okay.
So you still, if you mean you still have not finished the full course, yes, you can continue coming for the live sessions and apply the ones that you're doing to your other
so
to your other courses.
It does not require that this attendance will be available or will be valid for only the current unit, but the next unit we can do this attendance as well.
I don't think so. I don't think so. It's about how many you need. So many live practice sessions per unit and per course. So however many you take, you just report them accordingly. I don't think it matters to which unit you apply it.
Okay.
As long as you have as many as required, depending on what course you're taking.
Yes, I see. Thank you.
Okay, Gustavo, I'm not sure I understand your question. What do you mean? What is the topic? Topic of what? No, somebody.
I'm sorry. So I know the password is cardiology, but is there a topic for the whole session or
No,
You know,
well,
before you.
whatever dialogues we had, those are the topics. Were you following what
Oh,
dialogues we
okay.
had? Yeah. So we started
I
with
apologize.
kidney donor. Then we had pediatric cardiology. Then we
Yes.
had
And then,
ankyloglossia, tongue tie, and GI oncology.
thank you so much. I'm sorry.
Sure, no problem. Okay, anybody else?
I have a question, Tatiana. Is there are the dialogues and the discussions available in written form if we wanted to return to them and kind of go over what you covered? Like if tomorrow morning or tomorrow afternoon I wanted to go over the interpreting scenarios that we went over today, is there a way for me to access them or is that not
No, we
available?
basically, well, I like for today's set is what I personally provide. So that's basically every facilitator what we use. No, they're not anywhere. They're not accessible anywhere. Like I, for example, for this one, I purchased a book, and also I create my own scenarios based on my interpreter experience. So no, they're not published anywhere.
Oh, okay. All right. Okay, I
Okay,
just thought I'd check.
sure.
Thank you.
No problem. Anybody else? Okay, then I will see you next week. Good job, everyone.